Hi everyone, welcome back. My name is Melanie Grant and this is C&M Glass. This is our second video today discussing female reproductive systems and obstetrics. We've already covered our male reproductive system, and so we'll be covering some of the topics for female reproductive system, approaches, and obstetrical coding. This won't be too long of a video, but make sure you follow along with the reading, as this week's reading has some very important guidelines and instructions on how to approach the different scenarios within these two systems. So the first thing I wanted to cover on the board, and I've changed it from our last video, are guidelines specific to female reproductive and obstetrical coding, as well as some of the terms we'll be coming across in obstetrics. So the first thing with the guidelines that we want to look at, for female reproductive system, we have guidelines B43 and C2. B43 is basically one we've already seen in the male reproductive that states bilateral covers both sides when available, but otherwise code for two sides. Excuse me. So basically, as we saw before, if there's an option for a body part that says bilateral, we want to remember that that's going to be a code that covers both procedures when done bilaterally. But if the option is not there, we either code multiple procedures for each side or multiple procedures for just that body part if done to two different parts. Our code for C2 basically says that anything that's pertaining to products of conception, such as extractions, will code to the obstetrical section. Any non-baby related procedures will code to the female reproductive system. This applies for things like a D&C, where the patient is coming in for diagnostic purposes that are not obstetrical related, versus procedures that are. And so we want to keep in mind that anytime the patient is pregnant and is pregnancy related, you're going to be coding into the obstetrical section for pregnancy related surgeries and procedures. If it's not pregnancy related or she's not pregnant, then you would be coding under the female reproductive. And so you'll see a few different procedure options that will give you that definition. Now in our chapter 19 reading, we have a lot of anatomy alerts. Some of them, like our alert on the bottom of page 395, tells us some of the different parts that are included in the female reproductive system when they talk about uterine supporting structures. And they mention here for some of the ligaments as well that are part of the female reproductive system. You do have some great diagrams on page 396, but the most important thing that I found in this chapter is on 397, where they go through several different types of procedures and explain it to you to tell you exactly what is the purpose or the type of this procedure and how this should be coded in terms of your root operation. The thing to keep in mind is that with the female reproductive system, you're going to see a lot of medical terminology, and you're going to want to make sure to have your medical terminology book, a medical dictionary, Google if you like to search through Google, but either way, always define your terms. If you define the term, oftentimes you'll find out, first off, what is the purpose of the surgery, and second off, what is the type of surgery this is. There's a lot of different procedures in the female system that will be done with the same approach every time, and the name of the surgery itself is giving you that detail. If you find yourself stuck on a code as you're going through this system, make sure to review those for any kind of specifics in the female reproductive system. Okay, now there is one part on here, a couple of things that I wanted to point out. Sterilization, for example, is a great way of talking about how do I know the root operation is always occlusion. If you think about sterilization, you want to think about what it is that we're doing in order to sterilize a patient. If you remember, the root operation occlusion only applies to tubular body parts. And so you may be thinking that if I'm getting a patient that is sterilized, what is the purpose of what I am doing? And so they say, regardless of the method used, the approach to accomplish, regardless of the method, the actual procedure is occlusion. And so when you think about the different sterilization techniques, all of them are preventing pregnancy, which has to happen by the sperm going through the fallopian tubes and into the ovaries. And so in that case, we're trying to occlude that path from happening. Endometrial biopsies are also listed here, that you should note that any biopsy of the endometrial tissue is considered an extraction, not an excision. That is because the extraction is of the tissue and not of an actual body part. So the endometrial tissue often is the lining that is rejected from the body. Last but not least, a really great coding tip on 398 talks about for hysterectomies with multiple procedures with it, to always look at your procedures and include everything that's with it. So if you have a hysterectomy with bilateral salpingo-oophorectomy or a TAHBSO, this would require a code for each of those body parts because they're each identified as separate. And so you want to pay attention to what we're removing when we mention total. Is it with or without cervix? Is it with or without fallopian tubes or ovaries? Because this will affect how many codes you're going to have. Keep in mind also you will have those in bilateral options. Last but not least is the approaches in the female reproductive system. Keep in mind that anything that you can see through through the vagina is going to be considered a natural opening. And any organs associated here will be via natural or artificial opening. Anything on the outside that's going in is open, of course. We have laparoscopic as well as laparoscopic assisted vaginal, or if you remember, endoscopic through a natural opening. And then, of course, we have percutaneous options. So pay attention to exactly what we're looking at and where we're at. You have some of the definitions of the different terms you may see with that on 399 and 400, as well as on page 400 you have devices, and 401 includes your qualifiers. So take a look at all of those this week and make sure you pay attention to those as you're reviewing the coding options. Okay, so let's go ahead and code from the female reproductive system, and then we'll skip over to the obstetrical section here. I'm going to be looking at page 402 for case number 3 for colpexy. This is, of course, a vaginal prolapse where they're going in and repairing the vaginal wall. When you look at here, they have a patient with prolapsed vagina, which is repaired by suturing of the sacrosphineus ligament to the apex of the vagina using an open approach. Okay, so if we look at that to begin with, we want to say, is this female reproductive or baby related? It's not obstetrical, so we are going to be in the medical and surgical section. We know it's female reproductive, so it's going to be you. And then when we look at this, you may want to think that this is a repair because they are pulling up the prolapsed vagina and suturing, and each time we see the word suturing, we often think that this is a repair. But you want to look at what this actually is. This is where the vagina is starting to fall down and needs to be put back up into the body where it's supposed to be. And so if you think about that, you want to reassociate what is the type of procedure here, and even though they're using a suture to do it, they're actually repositioning the prolapsed vagina to put it back where it needs to be. And they're doing it with support of the suturing itself. And so you should be using the root operation S for repositioning, not repair. In this case, I can turn now to my table OUS. If I wanted to look in the front of my book, I could go there in the index and look up repositioning, or I could just go straight to the table that's associated with the 3 that we've built here. So I'm going to go straight to my table. I like to use the tables first. Okay, and I find that in my book, which is the 2018 ICD-10 PCS Codebook from Optum, ICD-10 PCS Expert Edition. You may have a different book, and that's fine. If you do, you'll be on a different page. I'm on the bottom of page 623. And I can see here 623 has 2 different tables on it, the first one being, ironically enough, for repair, which is OUQ. and then mine at the bottom for OUS. I will notice that there's two separate sections of this table. And when I look on the next page, I see the next table is OUT. So I know I'm not on the next page. I have just the one table with the two sections. And it's medical and surgical, female reproductive, repositioning. So I know that this is correct to what it is that I'm looking at. Now you want to identify what is it that we're repositioning. If you look at the note again and you see that it has the suturing of the ligaments, don't let that throw you off because you're not repositioning the ligaments. You're using that to support the repositioning of the prolapsed vagina. And so for that reason, the repositioning organ is the vagina, not a ligament. And so you want to look here under body part character 4 for the vagina. Make sure you look at both tables. You'll notice the first table does not have, first section of the table does not have an option for vagina, whereas the second section of the table does. And so I find that body part character is G, as in girl. And I notice that I have different options on the second part of the table than I do on the first. So I have open, percutaneous, endoscopic, natural open or artificial openings with and without endoscopic assistance or external. And if you remember when we read this, it said using an open approach. So I'm going to use character 0 for my approach, and then my device and qualifier are both Z, indicating there aren't any for this procedure. I can compare my code, and I have OUS G 0 ZZ, and so that's accurate. Now let's move on to the obstetrical section. So we've already mentioned a couple of terms here, and we've read through some of these guidelines. Additional guidelines that are in here for obstetrics are C2, which we've already read in the female reproductive, C1, and A7. Keep in mind, these guidelines really apply in all cases, but they're really more important here to remind you as it relates more often to this area. And so for C1, this is basically saying any fetal surgeries or surgeries to products of conception will code to the obstetrical section. All non-pregnancy related surgeries code normal. So if it's not to the pregnancy itself, then it's going to code to the body system or area it's in, even if she's pregnant. But if they're doing a procedure to her for the product of conception, or they're doing a procedure to the product of conception, then we're coding to obstetrics. And last but not least, A7. Why they put this one here on chapter 20, I can't tell you, but it basically says that coders can code directly from the tables without needing to look at the index first. We already kind of knew that, but let's take a look now at the obstetrical section because it's been a while since we've looked at a separate section. You'll find those at the back of your book, section 1, which comes after all of section 0. So we can kind of see how far back that is on my book here. And obstetrical section is going to be on 673 in this book. You'll notice that there's only one character for body system, which is 0, and it means pregnancy. And so anytime you're in obstetrics, you're always going to be section 1 with body system 0 for pregnancy. And then character 3 is talking for the root operations. You have a few of them that are very similar to what you've already seen and will have similar, if not identical, definitions. Your body parts, however, are very unique. You'll notice there's products of conception retained, and products of conception ectopic. The difference here being a product of conception is referring to any baby. Products of conception retained is referring to either tissue that's left in the body or tissue that did not become a baby. This happens in a miscarriage where the fetal tissue has not fully developed and is then removed. And then products of conception ectopic, also referred to as an ectopic pregnancy, or any time that there's fetal tissue that's outside of where it belongs. Again, referring to when it doesn't develop into a baby. You will have all of the same approaches here, a couple of devices, and a couple of qualifiers, which are actually more identifying the types of procedures in most cases. So pay attention as you're reading through Chapter 20 for our obstetrical section, and keep in mind that anytime it's pregnancy related, you need to be coding for obstetrics, not medical and surgical sections. Chapter 20 begins on page 413 and gives us a really great picture of the pregnant woman, showing where the baby typically is and the different body parts that are involved. Let's see. You do have some definitions in these first couple of pages, so read through this very carefully. The first thing I want to point out too is on the root operations for abortion versus delivery. These are some new ones that you haven't seen before. Many of you may have come from a coding background or may have taken other coding classes where we talk about in professional-based coding the terminology for abortion and how it's used interchangeably with any ending of a pregnancy. And so keep in mind that when you see the term abortion, it's not necessarily meaning that a patient has done an elective surgery to end a pregnancy, but it's simply meaning that the pregnancy did not continue. Now, in the operation, this is for artificially terminating pregnancy, and so that definition will be interchangeable, and you want to identify it from your doctor's notes who will be using a medical term for abortion, meaning any time the pregnancy is ended, whether it's a miscarriage, a chosen pregnancy termination, or otherwise, versus in the PCS world, which simply talks about the artificial termination of said pregnancy. So when you're looking at that, it's important to identify the root operation from the terminology. When we have a patient who has a retained product of conception, and it has a definition here for placental or fetal tissue that is not completely expelled from the uterus following a spontaneous abortion. So here's one of those terms. That's your term for miscarriage, surgical abortion, or delivery. An incomplete abortion or miscarriage is the presence of RPO6, which is retained products of conception, and I threw that on the board for you. A complete abortion or miscarriage is complete expulsion of all products of conception. And so you want to pay attention to those different terminologies, both in your reading of documentation when you code this section, as well as in the coding itself. Okay, so on that same note, you have your delivery and extraction. You want to look at the differences of delivery is something where the doctor is there and they're helping the patient deliver the baby. However, extraction is where they go in and they have to help to remove the baby. Okay, so if you think about it, and it gives a couple of examples here, anytime that you have a tool-assisted vaginal birth, such as a forceps, that's going to be considered extraction because they're pulling the baby out with the forceps. If the doctor goes in and puts his hand in to manipulate the baby's or her hand to manipulate the movement of the baby or the positioning, that's going to be considered extraction because their hand then becomes an instrument, as they put it. Any kind of cesarean procedures, even though it is cutting open the patient, you're still going to code for the root operation extraction, because the purpose of the procedure is to remove the baby from the body. Also, unlike other coding sections, there isn't a difference in a C-section done to a patient who had previously had a C-section or a vaginal birth to a patient with a previous C-section. The procedure stands alone in the term of what we're doing today. So you have a couple of really great definitions for this and some really great reading from pages 413 through 416. I would highly recommend reading through these. You have some definitions also. When you will be doing any kind of repairs to the patient after she has given birth, you want to keep in mind that those repairs, unless pertaining to products of conception, any repair for the female herself as following for our guideline C1, will go to the actual medical and surgical section. And so they gave some examples on page 416 of perineal laceration repairs. In vitro fertilization, just like with anything, you're going to code each procedure as a separate procedure because this is going to be done separately. And so you do have extraction of eggs, which is a surgical procedure. Fertilization of the eggs outside of the body, which falls under the other section. And then implantation, which falls under administration. So none of those being part of the obstetrical section. You have a couple of information on approaches and devices. And the one that's really unique and really gives a lot of detail in the system is going to be your qualifiers. So your obstetrics for qualifiers, as I mentioned, will depend on the type of procedure that's being done to help the patient. And they have a lot of different things here. You'll see the forceps based off of the different types. You see options for C-section. You see options for vacuum. So there's a lot of different types of procedures that are done in order to assist with the delivery. And those are going to be identified in your qualifiers. Make sure to read through this and become comfortable with those definitions because you will be using those as you're coding. Okay, so that's it for our chapter. Let's go ahead and look at one of our procedures here today. And we'll go ahead and use one that includes a qualifier. So I'm going to turn to case number 3 and look at, on page 420, the procedure for a vacuum extraction delivery. So if you remember from just kind of the reading and what we looked at, we're going to be starting with obstetrical section. So when we see the words, the patient was pregnant and delivered, we know automatically it's obstetrical for pregnancy. And the term is already used here, vacuum extraction delivery. But even if they had said vacuum assisted delivery, we want to remember that that's going to be root operation for extraction. Now pay attention to the root operations here and make sure you look at the letters in case they are different. For extraction in the obstetrical section is D as in David. Okay. I could actually code directly from 673 for most of, if not all of this. So if I read the documentation, states it's a vaginal delivery. So I know that it's going to be products of conception. It's not retained, it's not ectopic, so that's going to be body part 0. On my approach, this is going to be through the vagina. So this is a natural or artificial opening and should be used with character 7. There's nothing mentioned about a device, and so as far as my devices, I have monitoring devices, others, and no. So I'm going to say it's a no device, but I'm still going to look at table 10D to verify. I'm actually coding directly from the front table, which can be done by some coders. I personally like to verify it in the actual table. And so I will go there next after I look at this. I just wanted to show you how easy it is to build this code from just page 673. The last thing is my qualifier, and I know that it said vacuum, so I'm going to look for vacuum under my qualifier options. And I'm going to find that on character number 6. And so I should be 10D07Z6. Okay. Now I'm going to look at 10D just to verify this, and I find that on the next page, 674. On the very bottom, I'll notice there's several tables on this page because there's not a lot of differences between separate sections of the obstetrical section. 10D, the table before it is 10A, and the table after it is 10E. So I know that I'm only in this table. I also noticed that it's separated into 1, 2, 3, 4 sections, 2 of which are products of conception. And so I want to look at that and make sure that I'm in the right area. On the first one, I have products of conception open, without a device, and the option of classical, low, and extraperitoneal procedures. So if we remember that open is talking about cutting open, such as a C-section, that's not going to be my code. 10D07 is the next table natural opening. So they've separated it based off of the approach, still with no device, so we were correct. And here it gives the options from low forceps to other, including vacuum number 6 that we chose. So this is correct, and I can verify it that way. One of the benefits of looking at the actual table is it does break it down based off of what's typical and allowed, so you're not looking at everything trying to guess. One of the benefits of looking at the overall character meanings is that you can kind of see everything and build most of the code directly from there. Depending on your preference, make sure that you always verify your codes and that you verify the type of procedure you're looking at. That's all we have for today. This is our last module in this class for ICD-10 PCS. So if you have any questions or any issues you would like to cover, please make sure to let me know. My email or by text message for anything urgent. And until next time, I'll see you again. Thank you very much.